Hi, my name is Trent Harris. I work at Wise Physical Therapy in Grove City, Pennsylvania. Today I want to talk briefly about a condition called shoulder impingement. It's a main cause of shoulder pain. First, I just want to describe what shoulder impingement is. Shoulder impingement occurs when the tissues in your shoulder, there's a rotator cuff tendon and also a bursa that get impinged in between the two bones in the shoulder. And what happens is this causes inflammation and irritation. Now, when you get this inflammation, it causes increased pain, especially when you try to raise your arm up overhead, or even trying to reach behind your back to wash your back, or even to reach into your back pocket. So there's several causes of impingement. It can be specific to injury, such as trying to lift something up. You strain your rotator cuff, and it causes shoulder pain and inflammation, and that causes just a vicious cycle of pain. However, most of the time, impingement is caused by poor posture. People who have jobs where they're always reaching forward, bringing their shoulders forward, or repeated movements overhead. Now, it's very important to try to attempt to get some treatment for this as soon as possible, because if you don't get treatment for the impingement, the chronic inflammation can eventually cause a rotator cuff tear and eventually possibly surgery. Now, there's some signs and symptoms of impingement. The first sign is pain. If you have pain reaching up overhead, like I said, reaching behind your back, or if you have a lack of motion through the shoulder and you start noticing some decreased weakness throughout the shoulder and the rotator cuff, that's a good sign that it could be impingement. So for physical therapy wise, treatment for impingement is typically rest, ice, and performing physical therapy. As therapists, what we do for you is we develop and implement a physical therapy program, progressive therapeutic exercise program for you. And what that's going to do is that's going to help restore your overall function of your shoulder. It's going to improve your muscle balance of your shoulders. Now, what I mean by that is usually with impingement, the front musculature becomes tight and is overpowering your weaker back muscles and shoulder muscles. So then your shoulders come forward, you're closing off that space in the shoulder, and it causes more inflammation and impingement. So our goal for the therapeutic exercise program is to just improve that muscle balance, get your shoulders back more, and it opens up that space for tissue healing. We also do modalities for impingement, such as ultrasound, electrical muscle stimulation, and what these modalities do is they decrease swelling, decrease inflammation, and also decrease pain, and this will also promote the tissue healing. As therapists, we do manual techniques on you. We'll do some joint mobilizations on you, myofascial trigger point release, and these manual techniques will help decrease pain, improve range of motion, and also improve the overall health of the joint. So if you're experiencing shoulder pain, do not hesitate to call us at 724-458-9473, where you can schedule an appointment and get a thorough evaluation, and we can begin treatment to help you make a full recovery and get you back on your feet again.